often have a strong sense of ownership when it comes to their bodies.
For most people, knowing if and how their tissues are being used in research is a far bigger issue than profiting from them.
The federal policy for the protection of human subjects requires informed consent for all human subject research. Though, in practice, most tissue research isn't covered because A,
it is not federally funded,
or B,
the researcher never learns the identity of the donors.
If doctors want to gather tissues from patients for research purposes, they are required to get informed consent. But storing tissues from diagnostic procedures,
like a mole biopsy,
does not require consent. But these guidelines and ethical codes, like the Nuremberg Codes and the American Medical Codes of Ethics, aren't laws, and many tissue rights supporters say that internal revenue just doesn't work. Some activists believe that donors should have the right to say that they don't want their tissues used for research
on nuclear weapons,
abortion,
racial differences, intelligence, or anything that might run contrary to their beliefs.
Unfortunately,
this did not stop maniacs like Chester Southam.
Ooh, that name gives me the goosebumps.
Southam injected HeLa and other living cells in more than 600 people for his research. These were cancer cells. Southam wrote,
"It is of course inconsequential whether these are cancer cells or not, since they are foreign to the recipient. The only drawback to use cancer cells is the phobia and ignorance that surrounds the word cancer."
Southam did not tell his patients that the cells were
cancerous
because he did not want to cause any unnecessary fear.
To withhold such emotionally disturbing but medically not impertinent details is the best tradition of responsible clinical practice.
He was withholding information, as seen in the Tuskegee study, because he believed that patients may have refused to participate
if they had known what he was injecting.
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 Southam may have shared some characteristics of the Nazi doctors who conducted unthinkable research on Jews without their consent. For him, the Nuremberg Code, often thought of as
the Nazi Code,
was something that applied to barbarians and dictators, not to American doctors. I believe the patients in Southam's experiments had the right to know the contents in the syringe, and if this knowledge was to cause
fear and anxiety,
they had a right to be fearful and frightened and say
no, 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 no.
Even though there is a widespread confusion about how to assess the risk of gathering tissue from patients, as well as a refusal by some local researchers to cooperate, and an overall indifference by those charged with administrative research and its rules at local institutions, we must continue to protect donors and their rights. These cases are all illegal, immoral, and deplorable, and I believe that full disclosure of facts is necessary
to informed consent,
both being crucial
to the safety of patients and their families.